Recording in progress.
Everybody, good morning. We'll get started soon. Please feel free to put your names, pronouns, and your organization in the chat. We also ask that you change your name on Zoom to include your name and your organization as well. Thank you.
Recording in progress.
Thank you, everyone. So we will get started. This is the training for SCN invoicing for program administrators. This is our first one for this training module. And thank you for joining this morning. Next slide. Thank you. So this meeting is being recorded, and we will be sharing slides afterwards. So just some quick housekeeping things. Please keep yourself muted while the content is being delivered. The audio button is in the lower left-hand corner, should you need it. To react to content, as we go along today, you can use the react button, which is the heart right next to your chat bubble. And you can use reactions emojis to engage with what's being said today. We are using the Q&A box today to keep questions. It's just easier to track than having the questions in the chat. So we do ask that if you have any questions, please put them in the Q&A box rather than the chat. And so here's our agenda for today. So this will be a split training between Public Health Solutions and Unitas. So we'll start off with some introductions and overview. We'll go through kind of a broad scope of the invoicing timeline and requirements for screening, for navigation, and for service provision. We'll also go over just some basics about the fee schedule. Then we'll do the Unitas walkthrough, and then we'll come back for some wrap up and Q&A. So I'll be your trainer for the Public Health Solutions portion. I'm the Technical and Training Assistance Coordinator for the whole UNYC SCN. So our learning objectives today, to identify the reimbursement requirements for health-related social needs, screening, navigation, and also service delivery. To gain some familiarity with the invoicing workflow and timeline, and to give a little bit of more detail about that, and then to review the social care navigation invoicing process. Some group agreements. Please participate fully, ask any questions that you have, be flexible. We are, as I mentioned, this is our first training for this module. Let us know how you're feeling. Feel free to use those Zoom reactions that we talked about. Take care of yourself throughout the training. It's not required that you are on camera. Please feel free to get up, stretch, grab water if you need it. Embrace multiple perspectives and cultivate curiosity. Speak from your own experience, take space and make space. And then this is a place of learning. So embrace kind of the discomfort of wording with the new project and taking in some new information today. So starting off with an overview of the Social Care Network. To review Public Health Solutions, a little bit about us. We are the largest public health nonprofit serving New York City. We've been doing this work for over 65 years, and Public Health Solutions improves the health outcomes and helps families to thrive by directly providing services. We publish research. We support hundreds of community-based organizations through longstanding government partnerships as well. We're a leader in addressing crucial public health issues, including food and nutrition, health insurance access, maternal and child health, reproductive health, tobacco control, and HIV and AIDS prevention. And we have a strong focus on health equity to ensure that New York City families have the basics for a healthier life. So to go over the word salad, SCN, Social Care Network, HRSN, are health-related social needs. OHIP is the New York State Office of Health Insurance Program. MCO is a managed care organization. MMC stands for Medicaid Managed Care. FFS stands for Medicaid Fee for Service. The AHC HRSN screening tool is the Accountable Health Communities health-related social needs screening tool used during the screening portion of the workflow. And CBO is community-based organization, and enhanced service population is the Medicaid managed care members who meet specific criteria related to social risk factors, enhanced population alignment, and clinical criteria. Hopefully that's familiar to a few people. The SCN vision and goals are to ensure that health-related social needs of Medicaid members in New York State are consistently identified and addressed through consistent, timely screenings for HRSNs and navigation to HRSN services, shared end-to-end visibility of the member journey from screening through to delivery of services, and we have our Unitas platform to help with that, to access to high-quality HRSN services, and collaboration between HRSN service providers and partners in the social care network ecosystem. So some objectives of the social care network is to increase the capacity to identify Medicaid members that have unmet social needs and to be able to improve our ability to navigate them to services, to reach a broader set of populations that have enhanced social care services with enhanced social care services, to facilitate reimbursement for these services, to support system integration of physical, behavioral, and social care services, and to improve a member experience, and then to facilitate cross-sector data sharing via our tech platform. So this is our kind of overview on how the SCN is designed to address the social needs of our Medicaid members. We start off with screening. We're going to use that AHC standardized screening tool, the one that I kind of reviewed over in that word salad page. And if an unmet HRSN is identified, and the entity is not a social care navigator, they're going to be referred over to navigation services, right? So if the individual doing the screening is a navigator as well, you don't have to make that referral. You can just continue on to the next step. But if not, that referral can be made. And in navigation, that's where we're going to determine the eligibility for enhanced HRSN services, and that's through the eligibility assessment. And then the navigator will navigate the member to relevant HRSN services based on the results of that assessment. So it'll either be a referral to existing services if they are not eligible for enhanced HRSN services, or it would be a referral to some of the programs that are providing those enhanced services. And then on that HRSN service delivery portion, once a member is identified as being eligible, they're navigated over to the appropriate service. And after that service delivery, the HRSN provider would close the referral loop. So why screen and address for unmet HRSNs? So there is a large body of evidence that suggests that social factors account for a majority of modifiable contributors to healthy outcomes for a population. So around 80% of those modifiable health outcomes are related to social factors. And then 20% then is what the Medicaid medical care that is estimated to account for only 20% of modifiable contributors to healthy outcomes. So when we aren't meeting HRSNs, we're leaving gaps in healthcare coverage and care. We have increased medical costs, worse health outcomes, and perpetuation of health inequities. So getting into kind of the specifics about invoicing timelines and requirements for each of those stages that we just went over. So this is kind of an overview of all the invoicing activities. All these do take place on the Unitas platform. So we start off with Social Care Navigator and Enhanced HRSN Service Provider drafting an invoice at the time that services are rendered. You'll notice that we don't have screening on that little rectangle, and that's because screening is automatic. So we don't have that step of drafting the invoice. Once the invoice has been drafted by the provider, it's going to be sent over, and the invoice admin for the organization will review and submit it to PHS. PHS will then take a look at the invoice, and if there's any edits that are needed, send it back to the invoice admin. Again, this is all done on the Unitas platform, and we'll get some more review of that. Then PHS, if it's one that they approve, will approve the invoice and provide reimbursement within 30 days after an accurate invoice of service delivery. So I want to take a moment to just quickly discuss, I know there's been some mention about double dipping. And so to clarify, double dipping would be billing for the same services using multiple revenue streams. So let's say that your organization provides screening, and that screening is already covered through a different entity. Billing for that screening through our invoicing process would be considered double dipping. However, braiding funding is an option where HRSN service providers are able to use multiple funding sources to holistically address member needs. So Operating funding consists of multiple funding sources that are initially separate, but can be brought together to pay for more support for a member. So starting off with our screening, the requirements to receive reimbursement for screening is that it must be conducted by an employee of an organization contracted with the network. The member must give consent for data sharing. If that consent is absent, it's not a reimbursable screening. It must be conducted on behalf of a Medicaid member. Both fee-for-service and Medicaid managed care members are eligible. It has to be done using the standard AHC screening tool. It must be complete, and if you've joined in on our screening trainings, complete screening can have some questions that the member declines to answer, but then it has to be marked as so. It must be entered into Unitas. So there are options, and in the screening training, our lovely facilitators do talk about the possibility of multiple modalities in which a member can answer questions for that screening tool. But eventually it has to be entered into the Unitas platform. And then it has to involve a one-to-one member interaction, either somebody sitting with the member and going through the entirety of the screening tool, somebody reviewing it afterwards. It just has to involve a one-to-one interaction, and that can be done virtual or in person. And then lastly, the member must be eligible for either an annual screening or a verified rescreening due to a major life event. And so that timeline, the screening is completed and an invoice is automatically submitted to PHS via the Unitas platform upon completion of that screening. And so there's no lead admin responsibilities in the screening portion. Then moving on, we have our eligibility assessment and care management, with both fall under navigation. So in order for to receive reimbursement, navigation must be conducted on behalf of an enrolled Medicaid member. Again, both fee-for-service and Medicaid managed care members are eligible. Must be conducted by a social care navigator. Be time spent engaging with the member or on behalf of a member. So again, looking for that interaction with the member, and then be conducted using the Unitas platform. And if a member does not respond to outreach for eligibility assessments, outreach to the member cannot be reimbursable. And this is actually, this is the same for navigation and also enhanced care. So the timeline for outreach and for reimbursement. So members with identified unmet HRSNs should be successfully contacted within 5 business days. There is the expectation for at least 3 outreach attempts within 5 days, conducted via multiple modalities. And in our navigation training, we review that best practice for that is for these 3 outreach attempts to happen approximately every other day and at varying times. Members with identified unmet HRSNs are navigated to existing or enhanced services depending on what they qualify for as a result of that eligibility assessment within 7 business days. At that time, navigation services are billed for. And then upon receiving those services, members are then contacted and the case is closed out within 5 business days after that service completion. And then lastly, we have service delivery. So the requirements here is that it's conducted by an employee of the organization contracted within the network. that they have been referred through the SCN referral pathway. So it has to be that this member is coming to receive either enhanced services or um, enhanced services through a social care navigator that has used the Unitas platform. There is the option, let's say, for instance, that you have somebody that you believe has qualified or could qualify for these enhanced services and that reimbursement, but they've come to you independent of a social care navigator. At that point, you can reach out to PHS and we can get them processed through the screening and navigation process so that they can visit your organization again, being eligible for reimbursement. The member receiving services must have met enhanced HRSN service eligibility requirements. Again, that's that eligibility assessment that's conducted by a person in a navigator role. And then services are delivered are among the services approved by the SCM program. And that's stipulated in our fee schedule. So the timeline of referrals are made by organizations and should be accepted within 5 business days. The HRSN contracted partner needs to make at least 3 outreach attempts within 5 days. It's the same as navigation in terms of best practices, and also outreach attempts are not reimbursable. And then lastly, invoices are submitted after service delivery. So the services are going to be delivered. The organization will then be reimbursed for that afterwards. And so just a few more points about enhanced HRSN service reimbursement. So the majority of enhanced HRSN services may be reimbursed for up to 6 months. Some services do require a manual authorization, which requires documentation to be submitted on Unitas. For others, it is automatic and there is no action needed. Unitas does display the authorization duration and maximum allowable units, ranges, caps, and units of pre-authorized services. And lastly, payment will be made according to the New York State fee schedule for services. So just a quick overview of that fee schedule, and then we'll hop into Unitas. So the HRSN fee schedule, of which I just took a little snapshot of what that looks like so that you can reference it for yourself. Everybody should have received this fee schedule, and please feel free to reach out in the chat or in the QA box if you would like this resent. But the HRSN fee schedule includes guidance on how services should be delivered to receive reimbursement, and where relevant, maximum allowable units and frequency is specified. So here we'll see rates, which are the specific rates for delivery of service, and we'll also see per member caps, which is the maximum amount that can be spent on a particular service category, and it'll also give the duration of that as well. So whether that cap is per month, per year, that can all be found on the fee schedule. And just to give an overview of where reimbursements are coming from and the kind of process for Medicaid managed care members and fee for service. So reimbursements are made and will be delivered to the contracted HRSN service providers within 30 days after an accurate invoice, which we reviewed. And then payments will be made on a monthly basis for services provided on an ongoing basis. And then PHS has provided the fee schedule so that you can review those program caps and also the length of duration in which that's applicable. And then for fee for service, OHIP reimburses Public Health Solutions for the fee for service population upon a submitted claim via direct access to eMed New York for screening and navigation. And those claims are submitted within 90 days by PHS and provided. Fee for service would be the population which is receiving reimbursement for navigation. And then they would be the population that gets referred over to existing services. And so we'll take a pause for questions, and then we'll move on to the Unitas portion.
So, first question. Michelle Goudot from CCHP asks, what if service delivery takes a while, i.e. a few months, to help someone with housing? Do we have to wait till that's done for reimbursement, I gather? Is the question.
Yeah. So I will have to follow up on this question. But my understanding is that the invoicing is completed once the service is delivered, to be able to fully be able to include what needs to be reimbursed, right? Whether it met that cap or not. And so when thinking about housing, until that service is completely delivered, there's not a set amount that can be billed for. And so that's most
Can I ask a
likely why we
follow-up
would
to
wait.
that? Can I
Yeah,
ask a
sure.
quick follow-up? Can I do a quick follow-up? Sometimes when you're working with somebody, like you'll work on connecting them to something and then unfortunately, like they lose contact, you lose contact with them. And that just, I think a lot of us have experienced that happens a lot sometimes with our population we work with. So in that case, like if the service delivery wasn't actually able to be complete because that person, you were working with them, you were doing all this stuff, and then something happens and they no longer are responsive, how do we get reimbursed for that? Because we could spend months coordinating something and then unfortunately it doesn't work out, or they, something happens to them and they're not working with us anymore.
Yeah, I think you would get billed for what you were able to complete.
So after then you would put like the outreach attempts and you would kind of close it. And then once you close it, then you would get billed, you could bill for that?
So for the outreach attempts, again, until you reach the
No.
number, that's not reimbursable.
Yeah, that I understand. But I mean, like if you have to note that like your outreach attempts were made and then you can close it and then we can bill, or we bill per month. I guess I'm just still confused by like, if we're working with someone on something and every month we're doing something, can we bill monthly for the work we're doing with them, even if it's not complete?
Mhm.
Yeah.
So the billable services are stipulated in the fee service. So let's say it was a service that's on the fee schedule. And that was like a home remediation process, right? Where you started it, but you weren't able to complete it. You would be able to bill for what you started.
But we only bill it once it's like deemed like closed, whether it's lost to contact or we're finished with the delivery. We can't actually bill it if we're working on it for like a few months with them. We can't bill every month to get reimbursed for it.
Sorry, go ahead, Darren. I think I see you.
So that's the reason why the invoicing is important through the Unitas platform. So you'll be invoicing for each outreach as long as contact is being made. So you'll still be reimbursed for each contact, each service that's completed. However, if there's a long outreach timeline for that participant, unfortunately, we wouldn't be able to reimburse for non-contact. So what we can do is so the services that you'll be rendering will be reimbursed as they happen and occur with the participant, right?
Okay.
But if there is no contact, unfortunately, for a long period of time, it's not like all of your services won't be, reimbursed. You'll still be reimbursed for the services that occur, but the no contact is really the point. So if there's no contact with the actual participant, those specific services won't be reimbursed.
Okay, but the month, like if February I get connected to somebody, they need housing and I'm still working on it in March, I can still bill and get paid for the work I did in February and continue working with them in March.
Yeah, you'll be continuously, as long as there's contact, as long as there's work with that individual, you'll be reimbursed. But, if someone disappears on you, I get it. It's frustrating. It's, you know,
Mhm.
often you're doing a lot of great work. But unfortunately, if there's no contact with the individual, then it won't be
Yeah,
reimbursed.
that
So
I
what
understand, yeah.
and you know there's a question within that. So let's say you find out they do go to another organization, and you find out through, let's say, your organization finds out through the state or a shelter instead of the actual contact with the individual. We can find out on the back end whether that could be reimbursable. But I hear what you're saying.
Mhm. Okay, cool, thank you.
Sam
Yeah,
and Derek,
Camille.
I can just pop in really quickly, Michelle, just so that you have an understanding of how it will look in Unite Us. Once you start working with a client, you would open a case and then you can bill for every service that you provide to them. So, kind of what you were asking, let's say you're working with them for 6 months, you can continue to bill multiple times throughout that 6 months. And then once you're done working with them, then you would close the case, but it's not going to keep you from getting reimbursed for the services you've provided.
As it's happening, perfect, that's what I was trying to figure out. Thank you so much, thanks for your answers.
Of course.
May I ask a quick question, follow-up question? Would the services be like a drop-down list in Unitas? Or do we have to manually enter it?
And Holly.
Yeah, I'm not sure I fully understand. So the when you are at an HRSN organization like you all are, you will receive a referral, and that referral will be for a specific service type. So it might be for medically tailored meals, it might be for support with a specific housing need, or like pest remediation or something like that. So you don't have to choose. That will sort of already come through on the referral. But I'm not sure if that's exactly what you're asking.
Yes, thank you.
Perfect.
Great. And so the next question that I see here, if more than one family member, such as a parent or two children under 10, is screened and are all positive for the same needs, such as food insecurity, should only the caregiver be navigated to services? If only one is eligible for enhanced services, then should that member of the family be the one selected for navigation? So it seems like there's two questions here. The first is that if they are all positive for the same need, should only one member of the family be referred over for services? And this just the question.
Sam, I'm happy to hop in if that would be helpful.
Sure.
What I would say is there are some services that will make sense to send for, let's say, like mom and the child, right? Where they're eligible for they're both eligible for the enhanced services. And so maybe it's a food need, right? And so you're sending a referral both for mom and the child for the food need. There are other enhanced services that kind of don't make sense to send a referral on both mom and child's profiles. So something like a refrigerator, right? Let's say they need a refrigerator, and that need kind of comes up for both of them. It wouldn't make sense to send a referral for both mom and child if they're living in the same household for a refrigerator, because what that would mean is they would get two refrigerators. And that's true for a lot of the kind of like home remediation services as well. So those are things you're just going to want to think through as a navigator when sending those referrals.
Yeah, thank you, Camille. And then the second part of that is, if only one is eligible for enhanced services, then should that member of the family be the one selected for navigation? So everybody can actually go through with navigation, right? If a member is not eligible for enhanced services, they can still be referred to existing services that are federal, state, or local. And then that member that is eligible for enhanced services, yes, they should be referred for all the services that that's applicable to them. Next question, will organizations be reimbursed for all three services separately? So I'm assuming if an organization is providing, and this is from Teresa Manuel. So if an organization is providing screening, navigation, and the enhanced services, will they receive three separate kind of payments? Is that the question?
I think I saw this question, Samantha, in the chat, and the question, if I'm remembering it correctly, was if they are screened and they have care management and they receive an EHRSN service, are those all three invoiced separately? And in that case, the answer is yes. The screening invoice will, as long as they are eligible and the screening's done by someone who has the correct role in Unite Us, the screening will automatically be billed. The care management is billed as care management, and then the referrals that are sent for those EHRSN services, you add the contracted services on that case and submit those. You might have several invoices on one case for enhanced services, like if it's a food need and you're helping them over a period of time. I think that was the question I saw in the chat, but if not, feel free to clarify.
Thank you, Holly. And for the next question from Daniel, we have, how many months can someone receive the enhanced HRSN care management? 6 months max or 12 months max? So I'll pass this to Camille if you have an answer for this one.
Yeah, I'm sorry, what was the question?
Yeah, how many months can someone receive the enhanced HRSN care management? 6 months max or 12 months max?
If we could go back to there was a slide on this, just so that way we can get the exact answer, and if not, I can pull it up. Enhanced care management.
I think it would have been the one that we just passed.
That one?
I can pull it up and drop it in the chat if that makes sense.
Yeah, that one.
All right.
It doesn't specify about the enhanced care management. It just says some may be reimbursed for up to 6 months. It's not answering the question.
Yeah, so care management is multiple different services that can be included in care management.
Sorry, I found the answer. Enhanced care management, we are able to bill for 20 units per month for the waiver period, is what the manual says.
So it actually can be longer than 12 months.
Exactly.
Thank you.
What I will say is the thing you have to kind of keep in mind is if the person is still an enhanced population, right? So I think for like thinking about, like, let's say someone is postpartum 6 months, when you start working with them, then you would only be able to provide the enhanced care management services to them while they are still an enhanced population, right? So if they were 6 months postpartum, that would only last until they were 12 months postpartum.
Just adding on to that, also, as long as they are a eligible Medicaid member, keeping track of, when that's renewed, when their eligibility is redetermined, and keeping track of their eligibility through Medicaid. And then Brooke Montes, there are some services that may have a high price point, like housing needs. Who pays for this? I believe I've heard this question before, and the response given, Camille, if you could double check me on this, the response given is that the organization that's providing the service would need to pay upfront and then get reimbursed afterwards. Yeah, Camille's giving me a thumbs up for that one.
Could I add quickly?
Sure.
If there's something even smaller like transportation and someone needs to take a cab to a medical appointment, does the patient pay in that moment? Does the organization pay? I was just confused in terms of who bears the upfront costs and how we would get reimbursed.
So I just want to clarify first and foremost. So the reimbursable transportation costs are only if they are being transported to enhanced care services. But it would be the organization that would pay, and then the organization would be reimbursed. So it would have to be a scheduled car or something like that.
Okay, thank you.
Of course. And then I see you have a next question. Are there any required credentials to provide services? If we employ peer workers, can they provide some of the enhanced services? Also, so I'll pause there. Are there any required credentials to provide services? No, it's up to your organization to determine who you would like to provide each of the services. Next question. Also, for services that require a certified dietitian, nutritionist, can a student nutritionist intern provide some services under the supervision and oversight of a certified dietitian, nutritionist? So I believe this one actually is in the ops manual, and it is, again, Camila, if you could check me on this, it is required that it is a certified dietitian, nutritionist.
I believe so, but we can follow up after the call with the exact piece from the ops manual.
Thank you so much.
And now, just briefly, thank you, Sam, for taking these questions. Thank you, Camille, for jumping in, and Holly. Just briefly, if you're here, that means that you received an invite from via email, via Zoom, and we'd like to ensure that anyone else who is a part of the training is also receiving credit for the training. So make sure that you share with the individual the training outline and have them just sign in via Zoom and click the links. I will share that in the chat, and you will receive credit for being in today's training. And we thank you for all of your questions. We've got a lot of questions coming in, but we do want to try to get through today. So your questions will be answered.
With that, I'll pass it off to Unitas, and then we'll pop back in for some Q&A and wrap up afterwards.
All right. Hey, everybody. My name is Holly Stafford. I'm the senior manager of our customer education team here at Unitas. And I'm going to walk you through today
Recording stopped.
the process of invoicing at an EHRSN provider. So if you are identified as someone who can, as an organization who can provide enhanced services, what that invoicing process looks like. I'm going to share my screen really quickly. You're going to see my desktop. Please don't judge by how many little things I have back there, but here we go. All right, so I want to start by saying that we do have several different trainings that we complete. I know some of these questions that are coming in are around like screening and navigation and billing for those. That is part of a separate training. I know some of you are needing to attend several trainings because you're doing lots of different things. So like that training about like billing for screening and navigation, that is actually, I believe, this afternoon, if someone can like fact check me on that. Darren, is there a screener and navigation training this afternoon? I think at like 3, if I'm remembering correctly.
You are correct.
Okay. So if that is something that you feel like this is not answering your questions about, that screening and navigation and billing and invoicing for that, please attend that session, because I do think that session would come more closely to answering the questions you have around that. This session is really designed for us to review just if I work at a CBO or an HRSN provider, that I'm going to show you today how you can navigate the Unitas platform and manage your organization settings. I'm going to show you how you all have been identified, I believe, as someone who would be considered an invoice administrator at your organization. So you'll be sort of a stop along the way of the invoice before it goes to the payer, and you'll, have the ability to review that, to send it back, correct it, and you'll be in charge of seeing like if the invoices are paid and all of that. I'll walk through all of that today, and then we'll provide some information about how you can continue your learning and find additional support if you need it. So with that, again, we just want to make sure we're using that Q&A button. Sometimes questions tend to get lost if we use the chat for questions, so please put them in the Q&A. We'll get into the software here in just a moment. We do like to just, in all of our sessions, if you've attended several, you've seen this slide as many times as you've attended one of our sessions, we like to just really point out the state guidance on outreach and the expectation of how long it should take for that to happen. So you as an HRSN contracted partner, the expectation from the state is that you make at least 3 outreach attempts to the client within 5 business days of receiving a referral, and that you conduct that outreach across multiple modalities, so phone call, text, email, whatever options you have to reach them, and that you document each attempted outreach. And you can do that as a note in the case. And that is something that we covered. I know we did a session on that last Friday, which is how to deliver those services and bill for the contracted services. We have another one tomorrow. I believe it's at 11, where if you are someone who is not only an invoice administrator at your organization, but you also are going to potentially be partnering with clients to deliver those services, and you need to document those contracted services, that training is available tomorrow as well. All right. With that, I ran through just a lot of information up front. So if there are any questions that I need to stop for before we jump into the platform, I'll check in with Darren, Samantha, and Candace really quickly to see if we need to cover anything before we move into the demo.
No, please head on.
All right. So today I'm going to have to actually toggle between 2 users to show you all the parts of what I need to show you today. That is truly just like a demo situation. Everything that you will do and that you have access to, it will be available in your Unitas account. So I'm going to turn my camera off so that I tend to be quite animated when I speak, and I do not want that to be distracting. So I'm going to go off camera while I do this so you can really just focus on the screen here. Now I'm logged in here as a user. We're not going to look at all of this other stuff just yet, like the dashboard and the clients, because that will look different for you. But what I need to go to here is over here next to my name. I'm logged in as Rachel Lopez. You see this little gear right here next to my name. When I click on that, it is going to take me to my organization settings. I only have this ability if I have the organization admin role. So this is going to give me the ability to do some things and some housekeeping in our organization that other users who are like referral users are not able to do. So when I click on that, it brings me to the organization tab immediately. And I see I can edit the organization info. So like if we have a website update, if our hours change, I would just click this edit organization info and I can change that here. But the part that is really going to be important to you all, and I'm going to scroll down, is where it says programs here. Now, as you're working with the waiver, we know that there might be instances where y'all are currently at capacity. So you might not be able to continue like receiving referrals because you are at capacity supporting the referrals that you've already gotten. So if that's the case, you have the ability to edit the program right here. And if you click edit program, the only thing I'm going to show you how to edit, because on these payments programs, you don't want to edit like the name or anything like that. But the one thing you can do here is if I scroll down, I have program status in the program access. You see that right now this program is accepting referrals. If for some reason we need to not accept referrals for a period of time, perhaps like we have some folks on vacation and we're closed, maybe over the holidays, perhaps we are at capacity, I would just click that and then I would scroll down to the bottom where I can save my update. If I turn off the ability to receive referrals, when we're ready to receive referrals again, I would need to come back in here, go through that edit program process again, and change it back to accept referrals. It'll give me a notification that we're now accepting referrals. I'll acknowledge that. I would click save. It's grayed out here because that's actually where I started, but that's how I would turn off and on the ability to receive referrals. So if you're like inundated with work and you are unable for a small period of time to accept new referrals, you would do that under this organization tab. The one other piece that's going to be really important to you all with this work is you see I also have a users tab. If you need to add users, you'll need to reach out to, I believe it's your PHS contact, but again, if someone can, if that is wrong, please interrupt me. But to add users, you would need to go through the process of reaching out. However, let's say you have someone at your organization who has left and you need to remove their access to the platform. We usually want that to happen pretty quickly after a person leaves. So let's say that Jim Elkins here, he has left our organization. I'm going to click on his name and then I can click on editing user settings. You can see right now that his user status is set to active. If I click edit user settings, I can scroll down just a little bit and you see that I have the drop down here. I can change his status from active to inactive, which would remove his ability to log into Unitas. So we don't actually delete the user, we just set them as inactive and that would remove their ability to log in. I'm not going to actually update our friend Jim's access, but if I were to do that, I would change it to inactive and I would save it. Then if for whatever reason Jim came back to the organization, I could just reactivate him. I wouldn't need to create an entire new account. So that is kind of what you will do with those organization settings. Any questions there before we move into the payments and invoicing that we need to cover out loud?
Yeah, there's a question from Michelle. I think Ashley's handling it. But there's another question about, can you set at capacity only for a certain service?
Yes, so that's program based. So let's say that you're an organization that provides like a food pantry and you also provide medically tailored meals. If your medically tailored meals are at capacity, you would go into that program and set it at capacity. The other programs would not be affected unless you changed their status as well. All right. I am going to go now to my user that is going to look more similar to what you all see. So this is our user Diego. He is connected to a lot of organizations, which is why you saw that there. If some of you are care navigators and also service providers, you would see a screen like that as well, because you would be connected to multiple organizations. But if you are only if you only provide those contracted services, you would not see that screen. So as I'm here logged in as Diego, you see I have a few different tabs up here, one of them being this invoices tab. I'm only going to see that tab if I am identified as an invoice administrator at my organization. So you will have users at your organization who do not see that invoices tab. That's only going to be visible to those of you who are invoice administrators. But that's where I'm going to spend the majority of my time today. So I'm going to go ahead and click on that invoices tab. When I do that, you'll see down the left side of the screen here, we have a few different folders. We have our draft folder, which that's going to include all of the invoices that have a status of needs attention, as well as invoices that are rejected. You'll see, and rejected by you as the invoice administrator at your organization. Then you have this rejected folder. the rejected folder, there was a question about this earlier. This is going to be where I find invoices that were rejected by the payer, and I'll be able to look at the reason why those are rejected. We'll go over that in a bit. We have the disputed folder here. You will not be using disputed in your New York work, so that one you shouldn't ever have anything in there. The submitted folder are invoices that you have reviewed as the invoice administrator and that you have then submitted to the payer, and you can see that they have a status here of submitted to payer. We have accepted invoices. These are invoices that the payer has seen, and they have a status of either accepted by the payer or a status of paid by the payer. The payer has marked it as paid. Then we have our archived folder, and here we can see any invoices that you have manually archived. We will go through that in just a bit, so I'm going to put a pin in the archived folder. And then finally, we have the all invoices folder, which is where we're going to start here. You can see we have a variety of statuses here because it just shows us every invoice, and it's currently set to be in reverse chronological order with the most recent at the top, and then in that reverse date order. So what I want to show you here is how you can filter your invoices. So we have a few here that are status, invoice, and service provided. So if I want to look at all invoices for a particular type of service, I can. I'm going to click on the all filters button here, and I am going to look at the different invoice statuses that are available. So I have needs attention, and that means that the invoice was submitted by the primary worker for the case, and it's ready for my review. Submitted to network lead is not a status you'll be using. And we have submitted to payer. That means the invoice is submitted by you to the SCN payer. We won't be using in dispute. We have accepted. That means the invoices have been accepted by the payer. Paid means the invoice has been marked as paid by the payer. Rejected, those are those invoices that the payer has reviewed, and for some reason they have rejected them and entered a reason code that you can review and either correct and make new, or if it's rejected for a reason that is not something that you can fix and resubmit, then it would just stay in that rejected status. We don't have the network lead, and then also rejected by payer, and that's I'm sorry, I misspoke. Rejected is rejected by you as the invoice admin. Rejected by payer is rejected by the payer for some reason. All right, so those are all the different statuses that you have with your invoices. I'm going to jump up here to this draft invoice folder on the left, though. This is where the majority of my work as an invoice administrator is going to happen. So I can see I have several that need attention. I'm going to click on this invoice here that is for Sarah Joseph. And when I click on the invoice number, it's going to open up a detailed view of this invoice for me to review. So I can see a lot of information here, and that information is going to be helpful for me to determine if I would like to submit this invoice to the payer or if I would like to reject it and have it corrected before we submit it. I see that the client is enrolled in the social care coverage. And I can also see, if I scroll down a little bit, how much the authorized amount is available. So the remaining authorized amount is 11 meals on this one. I have an authorized service delivery date of 1/17 to 2/14. I see that Diego has submitted an invoice for 7 meals, which is an amount of $84 at the rate of $12 a meal. And I can see here that this is the original invoice for these healthy meals. So I can, if I look at this and something looks incorrect, perhaps that 7 is not looking right to me for the date range that that Diego submitted this. So I'm going to reject, and I'm going to have to choose a reason code. And I'm going to choose one of these pre-populated codes. I'm going to, for the sake of my example here, choose doesn't align with service delivered. And then I must include a note here. So my note, I'm going to put, please, oops, sorry about that. Please check number of meals delivered. And I'm going to reject that invoice. Once I do that, you can see that now this is in a status of rejected. I'm going to go back over here to my draft folder. And now what you see is this invoice for Sarah is now in a status of rejected. I'm going to click on that invoice once again. And you see that my option here is to fix and make a new invoice. So I've connected with the person at my organization. We realized that actually I mistook that, and we did have 7 meals delivered. So I can reopen it. I can correct the invoice. I can fix and make it new. And I do that down here in the contracted services. You see that it opened it back up down here, and I can either leave it, if it was at 7, I can leave it, and I can submit it for review, or if that number should have actually been different, I can update it, and I can then submit it for review. When I correct it and submit it, and then I go back to my invoices tab, what you will see here now is you'll see that rejected invoice is still there. It stays in that rejected status, but this invoice that needs attention, you see it has the same invoice number, but it has a -2. That tells me that's the second submission of this invoice, so that it was rejected for some reason and now we've submitted it again. I can go into that invoice, review it the same way I did before. This time though, I'm gonna review it and see that it is correct, at which point I will, up in the top right corner here, click submit. And now that invoice has been submitted to the payer. When I click back, you see that that submitted invoice is not in this folder anymore, because now it's gonna live down here in my submitted folder, where I can see that I just today submitted this invoice to the payer for payment. I'm going to pause there to see if there are any questions around either rejecting an invoice to make a new one and correct it, or submitting an invoice to the payer that we need to cover out loud.
Yeah, there's a couple of questions. So Nicole asked, are we able to configure each of our different types of staff working in different programs to only be able to document certain types of service to prevent double billing?
So I think I understand that question. I'm going to take a stab at answering it. And if I'm not on the mark, you'll have to just kind of follow up and let me know. So you will assign workers to specific service types. So let's say you provide medically tailored meals, and Candace and I both work at the organization, but I don't work with medically tailored meals program, but Candace does. I would not have the ability to accept an invoice or work with that program for medically tailored meals. So you can have multiple people though, like if we both are, working with that program for medically tailored meals. What happens when you accept a referral is you assign a primary worker, which means that that person is the primary point of contact for all of the services that go on with that client, which should mean that you don't have double work going on with the client. If that's not what you were asking, please jump back in and let me know.
Yeah, I think that's what I was asking. I think if I think about my different types of staff, so I have somebody working in core services and I have care management and we have housing staff. And so if to prevent double billing, in the meeting yesterday, Zach talked about care management and they cannot do navigation because we're already getting paid to do that navigation to local, state, and federal programs. And so I would want to configure my staff to prevent so that there's no confusion, and so that they cannot even submit an invoice for that service. So I would want to configure my staff to prevent double billing. Does that make sense?
Yep, absolutely. And then I think that primary worker, the assigned primary worker, is going to be, you might want to kind of work through with your staff to like a process of who's being assigned to what cases. If you have like a cadence of like,
Yes.
I mean, it's totally up to you. So I don't even want to like throw an example out there, but yeah, I think there are some just kind of procedures, standard operating procedures that you all will want to think through. But you can, users can be configured to be a part of a program or not. So if it's someone who's never going to be working with that program, you just wouldn't want them to be listed as a worker with that program.
Thank you.
Yeah.
Thank you. Yeah, Holly, we have another question
Sure.
from Mara, who asks, when I, as an invoice administrator, hit reject, does the staff who was the invoice generator, Diego in this case, get notified and have the ability to correct and or send back to me?
Ashley, I'm going to tag in my partner here. I believe the answer to that is yes, but if you have an answer beyond that, I will default to you if I can.
Yeah, let me read the question again. I was just answering one in the chat, so let me get caught up here. Candace, can you repeat the question you were
Yeah,
looking
of course. Yeah. Mara asked, when I, as the invoice administrator, hit reject, does the staff who was the invoice generator, Diego in this case, get notified and have the ability to correct and send back to me?
So they definitely have the ability to correct it and send a corrected invoice. Let me check on the user level notifications that would hit Diego in this case. So I'll follow up shortly.
Thank you, Ashley.
Do we have time for one more question or?
Sure, yeah.
Okay, cool. Okay, Jennifer asked, do we just archive the rejected invoice? Is a new one created and submitted? Does it show that a secondary invoice was created and submitted?
Yes. So archiving is what I'm actually going to go through next. So I'm going to hold on the question about archiving. However, when you ask, like, after it's been rejected, what happens? So that rejected invoice, initial invoice, because it was submitted and it wasn't deemed correct for some reason, that will remain rejected. That one itself doesn't ever change status again after being rejected. But what you'll see here in this example on my screen, actually the first two that you see here, both of them have this, where you see this -2 at the end, and this -2 at the end here. This one down here, a little almost to the bottom for $50 that I'm kind of circling, that does not have a -2. If you see a -2 or a -3, that number is going to tell you that's the number of times that invoice has been submitted. So it was rejected and resubmitted if it has a -2. If it has a -3, that means it was rejected and resubmitted, and it was rejected again and submitted again. So that number, if you see these -2 and or beyond that, hopefully we don't see a lot further than -2, but that's where you're going to know if this was a resubmission of an invoice that was rejected or if it's the original submission of the invoice.
Thank you. We can turn it back to you.
All right, perfect. So we've had some questions come up about archiving invoices. So I am going to go ahead and talk about that. So We use the archive feature when no further action can be taken on an invoice, and then I can archive it. What that will do is it will move an invoice from the archive or from its original folder to this archived folder. The status of the invoice, it's not going to change. So you can see here we have all different status types. However, it's just moving it to that folder to kind of clean up my view in some of these other folders. So I'm going to go back to my draft folder here. And we just rejected this invoice for Sarah and we created a new one. So this is in its final status, this rejected invoice. There's nothing else I'm going to do with this. So I can open this up and I can click to archive this invoice. When I archive it, that only moves it in my view. So if Candace and I work at the same organization and we are both invoice administrators, that does nothing to Candace's view. She's completely in charge of what she sees and where she sees it as far as archiving. It only archives it for myself. So don't worry that if you archive it, someone else isn't going to be able to find it. It's only going to archive it for you. So I'm going to go ahead and click this archive button. Now you see that it's changed the status here. I don't have archive anymore. I have unarchive. If I go to that archived folder, I now see that invoice for Sarah is the top of the list here. If for some reason I realize, wait, we aren't done with this, I actually do need to see it in my draft folder so I can take further action on it, I would just simply click this unarchive button and it would move it back to the last folder that had been in. And if I go back into my draft folder here, I can see that that rejected invoice is no longer there. Now it's as need action. So as you know, for me personally, this is totally a personal preference. I would probably, after I correct and make a new invoice, I would go ahead and for that rejected invoice that's in its like terminal status and isn't going to change anymore, I would probably, for my own organization purposes, move it to archived because I would know that I've already done what I needed to with that. I've corrected and made new, and that invoice is not something I'm going to need to do anything with any further. So that's the archive feature. It just truly is for you to kind of keep your own view clean and tidy for yourself, and it doesn't really affect anything else anyone at your organization does. Something else I want to show you here is sometimes you might need to download invoices as an invoice administrator. You might need to pull a report. So I'm going to click into this all invoices folder. And from here, this is where my filters will be very helpful. I can filter in any way that I choose, again, with these all filters. Let's say that I need to reconcile invoices that happened over the last 2 weeks. So I'm going to go to this service delivery date. And I'm going to say, let's see, what is today? I'm going to review invoices from 113 to 124, and I'm going to apply that filter. Once I do that, so this is all of the invoices that we've had across that 2-week period. If I click, I can click just individually. Oops, that just opens. I clicked on, if you click on anywhere on the bar here, it opens a quick view. And I missed the box when I was trying to click on that. I can just choose some, but let's say I want to reconcile all of the invoices over the last 2 weeks. If I click that top box, it check marks all of them. And now this download button has kind of lit up with that navy blue color. If I click that, it's going to export that file and I'll have a notification when it downloads that. I have probably a long list here, so it might take a few minutes or it won't, because you can see now here I have a notification that popped up on this bell in the top right corner, and that means that my invoice file is ready to download. Something else I can do, one last thing I want to show you here is if I go into the submitted folder and you see, let's see, accepted actually is where I want to go. These invoices that are marked as paid, I have the ability to go in, let's just open this first one. So the paid status tells me that that was marked as paid by PHS, by the payer organization. They put that in a paid status. What I have the ability to do here, there's a checkbox. If I want to track in here that we have actually received that payment, I can just check that box, which will then signify that we have physically received a payment outside of Unitas for this service for Brandon. All right. So that is kind of the process here of, being an org administrator, and setting your organization settings and user settings, as well as how to submit these invoices to the payer and to kind of keep track of those for your organization. Gonna pause to see if we have any questions, Candace.
Yes, we have a question from Danielle who asks, for large multi-service or high volume organizations, the invoice approver may be an admin far removed from the staff delivering services. Are there recommended workflows for supervisory review of the service delivery beforehand or as invoices are created for approval by admin?
Yeah, that is a great question. And I will say that I'll start what I'm about to say with like, it's truly up to your organization how you want to organize it. But at an organization that's, even at any size organization, I think thinking through, some standard operating procedures. So like if I'm an invoice administrator, what should I expect to see? Or even honestly backing it up further, if I'm delivering services, what is my organization expectation? Is it that I complete the invoice the day that I submit the invoice the day that I deliver the service? Is it that I wait and submit them to our invoice administrator like on a Friday? So like I leave them in that that status of oh my gosh, Ashley, help me. I either submit it or I save it as a draft.
Save it as a draft,
I don't
yes.
know why that was so hard for me right now. But maybe our organization says, for the week, save your invoices as a draft, review them on Fridays, submit all of them so that as the invoice administrator, or maybe you have like multiple services you're delivering and we submit medically tailored meals on Mondays. We submit, there are many ways to organize this. And it really is, the organization's choice. So I don't want to get too far into the weeds, other than just kind of suggesting a couple of options. I don't know, Ashley, if you have anything to add there.
No, I think you covered it. I think always, if there are really specific, like organization specific workflows or questions that you have, consult with PHS, but our team is also always available to have one-on-one sessions to kind of help you work through some of these really organization specific workflow questions.
Thank you. Thank you both. We have a couple of questions. Oh, Ashley's actually going after it. So thanks, Ashley. I think some folks have some questions about, Haley just put one in. She says, thank you, Unitas team, for all the support. Circling back to Chantel Brown's question earlier, my understanding is that all SEN invoicing needs to be conducted in Unitas, regardless of whether healthcare providers are conducting screenings in their EHR and ingesting screenings via their QE or directly on Unitas. I guess that's like a confirmation question. Is that correct?
So I think maybe the blanket statement there was that for an invoice, like for a service to be reimbursed, it must be invoiced through the Unitas platform. I'm not sure if that is clarifying or not, but the way that services will be reimbursed is through the invoicing process that happens on the Unitas platform.
Yeah, I think it was just more of confirming that information. Yeah. Okay.
Thank you.
Thank you. That's a great question. I think folks also are interested, which I know you will cover at the end of your slides, about how to continue their education on Unitas. So I'm going to pause at answering those questions until the very end. So I think that you can go to the next section.
All right, perfect. That is actually right where we're going, that question. So what we covered today was just the navigating your Unitas platform and managing those organization settings, managing your invoices if you are the CBO invoice administrator, getting those sent to payer and organizing that for your organization. And then next, what we're going to cover is how to continue your learning. So a few things that we have available here. You have your, oops, that was not supposed to happen. You have your in-app chat support. So from Mondays at 8 a.m., Monday through Friday, 8 a.m. to 11 p.m. Eastern, 8 a.m. to 11 p.m. Sorry, getting kind of twisted with my words here. There is a chat bubble available on the platform. If you have any questions regarding, something within the platform, if you have a question on where to find something, what to do, you can access that chat bubble at any time from right within the platform and ask our support team. They're amazing, super knowledgeable, often answer questions for me. So I highly recommend utilizing that. We also have our help center, which is that question mark that you see at the top of your screen in the top right corner. That's where you can find support articles and translated consent forms. If you are someone who, when you have a question, you like to read the answer versus like watch a video or something, the Help Center is where you'll find those articles that are going to be text-based with some screenshots as needed to answer. And then you can also reach our support team anytime via support@unitas.com. Just kind of running through here the types of questions you might have, because we know that you're partnering, with Unitas as your platform, but also you're partnering with PHS as your SCN. So if you have your support process here is to email support@Unitas or message the NS app chat support. That would be for Unitas functionality questions, like if you can't remember how to, download invoices. That would be a great question to chat in. Technical issues, maybe something isn't working the way you think it should be working. And then general support. If you have a specific New York 1115 workflow question around like the fee schedule or, when you should bill for something, those would be for your PHS point of contact. And honestly, your PHS team members are very knowledgeable on our platform and could probably answer many platform functionality questions too, but we also just want you to know that the Unitas team is available to support you for those, and we are happy to do that. And then Candace, could you put the whole NYC email in the chat? I didn't save that to copy and paste it this morning, but you will have an email that you can reach out to your PHS contacts with, and we'll get that email address put in the chat here for you. We also have Unitas Learn, which you can access by clicking the graduation cap that you'll see in the top right corner of your screen. There you will have the ability to view live online training. So folks from my team deliver live trainings weekly. You can register for those and attend those, as well as some self-paced learning opportunities. So if you're someone who prefers to see videos, prefer to do it kind of on your own time, on demand, those are available for you to access at any time of day to review any of these workflows. For invoice administrators, so for those of you who, I'm going to pause and show you the video first. So you'll access Unitas Learn by clicking that graduation cap in the top right corner. And once you do, you will scroll down. You'll see the online live training opportunities and then these self-paced learning opportunities all the way at the bottom. You can click payments courses, and this is going to sort out just those courses that are related to this new functionality around like invoicing, all of that. So The course that we would recommend for you as invoice administrators, there's a course that's called Payments Invoicing for CBO Administrators. So if you are someone who is going to be, reviewing invoices for your organization, we would recommend that as your course that you would review. If you're also someone who's going to be delivering services, we have a course here for documenting contracted services, Unitas billing, that you would also be able to review. So with that, I am going to pause and see if we have any additional questions, because that kind of wraps up my part here.
Yeah, thank you so much, Unitas. Thank you so much, Holly and Ashley, for all of your knowledge on the platform. Just as a quick, PHS is gonna do some wrap up, but before I pass it over to Samantha again, I just wanted to say that in order to go live on Unitas, you would have to have completed your PRF and your MSA and be in line with that timeline in order to go live in February. If you are slightly off of that timeline, we are doing a rolling waves of onboarding onto Unitas and the whole NYCSCN network. So just to make sure that, all of your administrative documentation is, in, and you'll be live the first week of February. And I'm going to pass it to Samantha to wrap us up.
Okay, thank you, Candace. So I just wanted to bring this slide back up and reemphasize what Darren had said earlier. So for anybody that received an email today, a notification from Zoom, you've already completed this step. But if you have anybody in the room with you, if you're sharing, viewing this training along with someone else, please just make sure that they also independently register. Just to review some resources here. So the operations manual has been posted by New York State. It's available, and I'll ask Candace if they can drop that in the chat. For resources that we have put out so far, we have released the revised AHC screening tool. We will be getting back with all of the training slides. For right now, we have released the training schedule. You'll receive the SCN 101 slides, screening, navigation, all the way through this invoicing training as well. On PHS's YouTube, there are provider onboarding meetings, workgroup meetings. We also have our mandated reporter link. So this is required for all individuals working with children, or all individuals who will be working with children through the Unitas platform, are required to complete the New York State 2-hour mandated reporter training. If you've already completed it, please go ahead and download that certificate, and that is what you are uploading to this mandated reporter link. And then we've also thrown in the link for the Unitas Learn platform. So some upcoming trainings. We have our last screeners training coming up on the 27th. We have our last navigators training on the 28th. We have our last two more enhanced services, one tomorrow and then one the 30th. And thank you. You can, if you guys would all just take a moment and fill out this feedback form. We really do use this to improve our trainings moving forwards. We will have very shortly the schedule for next month's trainings coming out to you, and we use all this data to improve our process here. So I'm going to give everybody a second to point their cameras and add this in. Okay. And lastly, I know Candace, through this in the chat, but for member-related inquiries, you can reach out to getinfo@healthsolutions.org for training and technical assistance. Please reach out to support HolyUNYCSCN@healthsolutions.org. And for IT-related inquiries, you can reach Unitas at support@unitas.com. Okay. And then lastly, I just want to say thank you to all for attending this training this morning. And we will be following up again with the slide decks and with Q&As, any unanswered questions that are remaining. Thank you all. If Christina's still on, yes, we do take attendance through the registration form, and so that's how we're delivering credit. Also, Omalara, if you're still on, just let me know, and I could throw the mandated reporter link in the chat.
I already
You
put
can
it in the chat.
Okay, great.
Yeah.
Thank you.
Okay, PHS team, do we feel good?
Yep.
All right, thank you, everyone. Appreciate you.
Okay.